Hello everyone, and warm welcome to our very first peer support session for this WHO Scholar Level 1 certification course on Comprehensive VPD Surveillance. And I'm glad that we have with us Dr. Anidia Sekabose from WHO headquarters in Geneva, who will be our guide on the site during today's session. And two things that are very important: if you don't have access to this course resource folder, I'd like to encourage you to go ahead and click on the link that I'll share in chat, because there you find all of the resources for this course. Also, Reda just shared a link in the chat. Make sure, remember, we said certification requirements. You have your attendance and the completion of the various feedback, individual feedback sessions 1 and 2. So you can click on the link that he has just shared to verify that you are up to date as far as those tasks are concerned. And for those who maybe have not turned on, if you cannot hear me, probably you have not turned on your audio. I'm seeing just one person, Maya, probably a problem of connectivity, because Maya is familiar with our sessions. So if Maya can just go ahead and unmute and turn on the audio. Also, how to stop incoming videos if you're having bandwidth issues. It can help you to save your bandwidth if you're having connectivity issues. And feel free to raise your hand if you desire to speak, and I'll be delighted to invite you to unmute yourself. So where are we as far as course is concerned? Today, tomorrow, we are in session 3. You are working mostly offline to develop your IA20, your VPD surveillance action. The deadline is due tomorrow, Thursday. It's due tomorrow, Thursday, 14th of July, 11:59 p.m. Geneva time. And after peer grade is automatically turn off, you not be able to complete the course. So I'm encouraging you to get to your action plan. What I can say is, if you are seated beside your computer, open your action plan. And if you have not yet downloaded the template, I'm just going to share it right here to ensure that you have it, that with you, and you can start working on your action plan right away. I'm encouraging you at least to put that template and start working on your action plan right away. So I'm sharing it with you in the chat. And I hope you're able to hear me, because I'm getting indications that my connectivity is unstable. Okay, thank you for reassuring me, Imam Wadablo. Now I have two questions for you. My first question, we are going to look at it now, is have you joined peer grade? I think Hanan, have you joined peer grade? So that is a question that is on the screen. And can you just answer with a yes in the chat? A yes or a no in the chat. And when I checked this morning, we had around 31 scholars who had already joined the peer grade, and 2 people who have already submitted their action plan. I'm seeing that most of the far is only yes. If you have not yet joined peer grade, please can you type no in the chat if you have not yet joined peer grade. So far I'm only yeses. I'm seeing only yeses, so it means that. So if anyone in the room, if you have difficulties with joining peer grade, okay, I see Chrisal Bodo, Ngwatu, that says no. Amanya Jacob also says no. So I'm going to invite Chrisal. Chrisal, are you able to unmute yourself? Chrisal, okay. Chrisal, good morning, please. Chrisal, please unmute again. I accidentally muted you.
Yes, thank you. Good morning.
Good morning to you. So, Chrisal, are you having any challenge with joining peer grade?
But the challenge I had yesterday I was trying to join was mainly network. So I've not tried this morning because of some issues, but I'm trying to join the peer grade currently as we are discussing.
Okay, are you connected to the computer?
Sorry?
Are you connected to your computer? Are you joining the session from your computer?
Yes, today I'm joining with my computer.
Okay, so are you able to share your screen so we can guide you on how to join peer group? And you actually do it now.
Okay.
All right, so I'll stop sharing my screen so that you can share yours. Is that okay? Are you hearing me? I see you're muted.
Yeah, please, can you share the link with me again? I seem not to
Yes,
find
I'm
it.
going to put the link right away in the chat. And if you also answered no to that question, like Crystal, please go ahead and click on this link so that right now you will join. So I've just shared the link with you in the chat. So let me share the link in a way that you have to just click on it and it works for you.
Hello, are you referring to the link you shared, which is the Dropbox?
No, not the Dropbox. I've just shared the peer grade link in the chat. And I see Crystal, okay, you're already sharing your screen. That's great. So,
excuse me.
Yes, who is talking, please?
Good morning, Soransora. Soransora
Yes,
from
okay.
Isiolo, Kenya.
Okay, go ahead, Soransora.
Yeah, we had a lot of difficulties in accessing the peer grade. So even through your link, it is becoming very difficult again.
Why is it difficult? Are you having connectivity issues? What is the problem?
My connectivity issue is actually very perfect.
So what is the problem? I've just shared the link again, and Crystal, just let me share the access code with you. Let me share the access code with you right now in the chat.
I tried last night, this morning, and now even, you know, okay, here so, it is almost afternoon.
Soransora,
yes,
are
my
you
dear.
connected to your computer?
Yes.
Okay, have you clicked on the link that I've just shared?
That's exactly what I'm doing.
Okay, just be following the steps that Crystal is showing right now on the screen. Okay, so yes, Crystal, you put in your name because it's the first time, your email address. I hope it's the same email address that you used to apply for the course.
Very well.
Yes, it's the same email address I used.
Okay, that's great. And you put in a password that you will remember.
Yes.
Okay. And then click on sign up.
Yes.
And please, if you're just joining us and you have not yet joined peer grade, I am encouraging you to follow the same steps like Crystal and join peer grade right now. Don't wait till tomorrow. Don't wait till when you're finished your action plan before you're submitting, because you may have challenges at that time. So go ahead and follow. Okay, congratulations, Crystal. You see, it is a process that's simple and straightforward. It doesn't take you up to 3 minutes to do so. So once you have seen this page submit, it means that you are ready, that you have joined peer grade successfully, and that you are now able to submit your work once it's ready. So Crystal, can you just do another demonstration, like click on submit? Okay, so your work is not yet ready. Your work is not yet ready, so I'm not going to ask you to submit now, but just for the sake of demonstration, can you scroll down? Scroll down to the bottom of the page. There you actually see, you can still use that page to download the rubric and the template. Continue to scroll down. These are just instructions. Okay, so where you see your attachments, say upload file, you have to click there and go to your computer where you have saved your action plan to upload it. Once you have uploaded it, okay, that's good. So you select, you upload it. Once you have uploaded it, you click submit.
Okay, thank you for the instructions. Well received on my side.
So, okay, thank you. You can stop sharing your screen.
So me, I thought previously, speaking in Soransora again,
yes,
you just go into the link, do your work there, and it will remain there. So it is a matter of saving and then moving to the site.
Soransora, have you been able? Have you joined PeerGrade?
I earlier indicated that I had some difficulties.
And I have shared the link in the chat. I want you to join now.
Kindly resend.
Okay, so I'm sharing the link with you again in the chat. Please, can you try again? So I've just sent it. Click on the link that I've just shared. And I see a question from Atem. Are you?
Join the peer group.
It is sorry, let me say.
I didn't hear you. Please go ahead.
My computer is saying you are leaving Zoom. Kindly proceed to continue to the link.
No, you don't need to leave. You don't need to leave Zoom. You don't need to leave Zoom. You can actually just click on the link while you are still in Zoom. And thank you for responding to Atem Reda, because there is an email with everything that we did yesterday, and also on the Telegram channel, all the resources, the details, the videos of what we did yesterday are shared there. So I'll just share my screen. If there is any other person, if you're having a challenge with joining PeerGrade, please I would like you to raise your hand of order. I would like you to raise your hand and indicate where your challenge is so that we can support you. All right, so so I already shared the link in the chat. If you want to join PeerGrade, the link and the code, that's all you need. And then once you are there, once you click on the link and you put in the code that you are asked and click on next, you have this page. What Crystal did earlier on, he clicked on create account because it's his first time of accessing PeerGrade. So account. If you already have an account in PeerGrade, all you need to do is to log in. That is the next thing. And then afterwards, what you do is your account, you need to put in your full name, email address, the same email address that you use to apply for the course, and then you click on sign up. Now, some people indicated to me yesterday that they have forgotten their password, even though they have an account. You forget password, once you click on that, read the instructions that will follow. You will be asked to put in your email address, and you will receive a special link to put in a new password, to generate a new password. You follow that, and you'll be able to access it without any problem. So I'm showing these slides for the sake of Soransora that was indicated on integrity. Now, the last thing you need to do is how do you know you have joined PeerGrade successfully? Is once you see this page and you see VPD Surveillance Action Plan initial version. That is what Crystal showed us earlier on. And then once you have successfully PeerGrade, and you want to relog in, that's you have joined for the first time, and you want to relog in, you need to use this link. So if Crystal, for example, if you log out right now and want to relog into PeerGrade, this is the link you're going to use. And once you click on that link, you'll be asked to log in. That is, you type in your email address and your password to log in, and then it will take you back to the page of the course where you can submit your assignment. So, and to submit the assignment, Crystal actually showed that. And so we are probably going to practice this tomorrow when someone will be ready to submit their action plan. So my next question, the next you, and I'm keeping my eyes on the participant list. If you have any concern, if you have any question, go ahead, raise your hand to ask your question. You can type it in the chat and we will try to respond. I see Maita says, I had some challenges yesterday, but was successful this morning, Kenya time. I think it depends on the strength of the network. Thank you so much, Eric, and bravo to you for succeeding to join Peer Grade. All right, so now my next question for you, and you're going to answer by a yes or a no in the chat. Have you started your action plan? And when I checked this morning, 2 people had already submitted their action plans, and I verified correct documents. Seeing yes, Jamal yes, and Harriet yes. We have 30 in the room. We are 30 in the room, but only 3 people so far have answered yes. Okay, so seeing only yeses have started. Okay, have started. Okay, that's good. So it's only yeses. I'm yet to see a no. And please feel free, if you have not yet started, if you're facing a delay, don't feel ashamed. Say no, I'm not started. All right, so far so good. I'm seeing only yeses. All right, so I'm going to remember that the IA 2030 action plan is, is the most important, the VPD surveillance action plan, sorry, is the most important deliverable for the course. And 3 of the 5 actually depend on that. But one thing I'm going to emphasize is, the IA 2030, the action plan is important. You have to submit it, but the peer review process is another important aspect, and it is not necessary for you to develop an action plan. You are not going to do peer review, because if you submit in that action plan, if you don't do 3 peer reviews, you are not going to certify. So for you, if you are engaged to develop action plan and you submit it, to do Oh, I'm so sorry. It happens, having serious connectivity challenges these days, but I am back and I hope you're able to hear me now. All right, so let me go back to sharing my screen. So as I was saying, so Eric, so as I was saying that the action plan is the most important deliverable for the course, because 3 out of the 5 certification requirements depend on it. And if you are going to do peer review, I would like to encourage you that you, first of all, if you know you're not committed to doing peer review, then there's no need to develop the action plan, because you will not get certified. So peer review is also an indispensable process in the course, and we're going to look at that into more details tomorrow. So right now, what I'm going to ask you to do is to raise your hand if you want to share your VPD action plan. So I was just saying that your action plan, what is it all about? You have to identify your most important challenge with VPD surveillance where you work. You have to identify that, and then you have to explain your VPD surveillance context, including that is the workforce, laboratory information systems, applied research, and sustainable financing to help your peer reviewers, to help others understand why your challenge is important. And then you need to set a specific goal you would like to achieve related to the challenge you identify, and you prioritize concrete action steps to achieve your goal. So I'm going to invite you right now, if you have started, and I'm glad most people indicated in the chat that they have started working on their action plan. So please raise your hand if you want to share what you have already done. It must not be a complete work, but just share your challenge, the most important challenge. This session is like an extension of the group work that was done yesterday. But the only difference is that it is you now sharing your individual work. So what is your most important challenge in relation to VPD surveillance where you work? And then secondly, what is your context and what are the concrete action steps that you're going to take? What is your goal? So please feel free to raise your hand if you want to share your VPD surveillance challenge with the rest of the group. And I see a comment: should the actions be of 3 types, that's short-term, mid-term, or long-term? So that's a good question, Hannah. If you set an action, you're going to indicate, the question is indicate if the action is long-term. If it's long-term, or if it's short-term, you indicate if it's short-term. If it's long-term, you indicate if it's long-term. If it's medium-term, you indicate if it's medium-term. So one action cannot be all 3 at the same time. So some of your actions could you do in the nearest future, and some others will be maybe over time, more long-term. I'm going to invite you, if you're already thinking about actions, so if you're able to unmute yourself, if you can share, just share with us briefly what you're working on, what is your goal. I want you to unmute. You're able to unmute yourself. And I also see a comment from Feza Rabani that says non-availability of data after COVID pandemic, to research the current situation to teach the workforce in accordance with IA 2030 guidelines. So Feza Rabani, Feza, I'm also asking you.
Hi,
okay,
can you hear me?
Yes, Hannah, we can hear you.
Would you like me to share my screen?
Yeah, if you're able to share your screen, I'll stop sharing mine so that you can do so.
Thank you. Just one clarification. We don't need to submit the 3 types of actions. Like one is for the short term, and one for the medium term, and the other one for the long term. We can come up with only one type of action and state whether it is short or long or medium, right?
Yeah, so Hannah, what I'll suggest you do, and I'm glad we have Anna Minter with us here, she's a guide on the side. So what I'll suggest you do is, can you just share your screen and show us what you have already done so far? And afterwards, we'll turn towards peers in the room and also Anna to get their feedback. So just share with us, start with your challenge, your VIP, yeah, and just go through what you have already done. And while Hanan is presenting, I'll be inviting you. You can share your comments in the chat or your questions, or you can raise your hand if you have any questions or comments for her. Okay, over to you, Hanan.
Thank you very much. So my action is to enhance VPD surveillance to the optimum standards. And the VPD surveillance challenge is collection of samples according to the required laboratory standards and sending them within the time limit. So in the context regarding the workforce at the health facility level, hospital or primary healthcare center, there is one surveillance officer who is responsible for other public health programs as well. There is also one surveillance officer who is responsible for other public health programs at the district levels, and all are connected to the surveillance officer at the governorate level. In addition, there are VPDs officers at the governorate levels who are responsible for prevention and control activities for other communicable diseases as well. Both surveillance officer and VPD officers communicate with the immunization officer at the governorate level and the national level. Surveillance officers uses the immediate notification form, while the VPD's officers use the disease case investigation form. Both depends on the annual communicable disease control plan that has the case definitions for communicable diseases under surveillance, including vaccine-preventable diseases. There's continuous staff turnover at the facility level, and this can negatively affect the reporting to the surveillance units and section. Surveillance section plan include conducting 2 training workshops per year. Other VPD sections plan also include conducting 2 workshops per year. The workshops at the national level are directed to the surveillance officers at the governorate levels, who should in turn train surveillance officers, public health officers at the district level. The surveillance officer, public health officers at the district level should train surveillance officer, public health officers at the facility level. The CPHL also has training workshops for laboratory personnel at the governorate level. Trainers in these workshops include surveillance officers, VPDs officers, laboratory officers. Occasionally, the trainers include only surveillance officers and VPDs officers. National and subnational supervisory visits to monitor the surveillance of all communicable diseases, including VPDs, based on a predefined checklist are conducted on need. However, items outside the checklist can be identified and corrected immediately. NGOs like WHO and FNet usually provide support to enhance building capacities at the national level. WHO also provides support to CPHL in supplementing with laboratory equipment. In addition, the WHO has financially supported AFB surveillance, which helped improving the indicators. Nevertheless, it threatened the performance of unsupported VPDs. Laboratory samples are either taken by the lab personnel, whether he is trained or not, nurse or other healthcare workers based on their availability, and these samples will be kept at the facility or transported to the district to be transported to CPHL. VPD's confirmatory tests are mainly at the CPHL. All 20 DOHs have their own public health laboratory to perform initial tests and send the positive samples and the 10% of the negatives to CPHL. CPHL and the Provincial Public Health Laboratory are governmental led, and nevertheless, there are private labs who can test for some VPDs, and these are not reporting to the surveillance section except 1 or 2 of them. And the CPHL routinely does tests for polio, measles, and rubella, diphtheria, Neisseria meningitis, Streptococcus pneumoniae, cholera, hepatitis B, typhoid, and influenza. That is, CPHL can test CSF, urine, nasopharyngeal swabs, blood, serum, and stool. PCR, enzyme immunoassay, Western blot, bacterial culture, and antimicrobial resistance testing and sequencing are all available at the CPHL for confirmation. Each VPD has its own lab within the broader classification. That is, there is a section for virology, within which there is a national polio lab, national influenza lab, national measles and or rubella, national enteric lab for cholera and typhoid, and national meningitis lab. Also, national bloodborne lab, which includes viral hepatitis and HIV, and the laboratory guidance documents are disease specific. Activities like monthly salaries, training workshops, provision of some testing kits are supported by the government. Nevertheless, some training workshops and the provisions of some testing kits are supported by NGOs like WHO and FNet. And the transportation of the samples that require confirmation at the regional labs are covered by the WHO for acute flaccid paralysis. National Polio Lab, National Influenza Lab, and National Measles Lab are all linked to their counterparts at the WHO MRO lab, and they always send samples for confirmation and external quality assurance based on the predefined plan. And the CPHL itself provide a quality assurance test for provincial public health laboratory. The specimen transportation system is not specific for VPDs except for polio because it is supported by the WHO. Consequently, some of the governorates use the same AFB transportation personnel to transport other samples. In case another VPD sample is collected after that, they will wait for the next transportation trip to transport the samples to CPHL, which could affect the quality and the adequacy of the sample. The National Polio Lab, National Influenza Lab, and the National Meningitis Lab provide results to both surveillance officer and communicable disease officer at the national level, who in turn will send these results to the surveillance officer at the governorate level, who will send it to the facility. Laboratory staff always participate in capacity building opportunities inside and outside the country that are either supported by the government or NGOs. The training opportunities could be disease specific or general. In addition, laboratory staff participate in supervisory visits in collaboration with the surveillance staff. The information system used in the lab is variable based on the lab. For example, the National Polio Lab uses the WHO prepared Excel for the results. The National Influenza Lab and the National Meningitis Lab use local Excel for documenting the results and sharing it with the surveillance section. The National Measles Lab uses a software designed by the WHO Measles Lab EVA, and in contrast, the surveillance system uses info-based templates and coordinate with the lab to compare the information available in both data sets. Some VPDs yes.
Hanan, please, I see your context is very well detailed, and that's so great. But can you just move a little bit lower to your goal and then the actions? Just share with us briefly your goal.
Okay. Okay, so the goal is to create a task force of surveillance officer, communicable disease officer, immunization officer, and laboratory officers to work on a comprehensive budget plan that addresses VPDs from aspects of surveillance, investigation, sample transport, action, guidelines, training, and information sharing. And creating a task force will bring all the concerned entities into the table. All should work on a workflow mechanism with identification of the dataset tools that all should work on. In addition, NGOs and lab should agree on kit supply plan that ensures the kits are available when needed without any loss due to expiration. So the concrete actions to achieve my goal is creating a task force, and this is a short term, and the action will be a meeting at the national level, and including all the concerned parties like surveillance officer, communicable disease officer, immunization officer, and laboratory officers. And the resources will be covered of this meeting by the national budget, and we will use the national budget to cover all the activities that are required and determine where we have defects so that the NGOs can cover that. So the outcome will be a workflow diagram, guidelines for VPDs, diagnosis and surveillance, transportation mechanism, identifying VPDs that can be confirmed at the provincial labs. And the risks to successful implementation include routine administrative issues that can hinder the development of alternative transportation plan or kit supply plan. So that's all from me, and I apologize if I took too long, and I'm looking forward for your feedback. Thank you.
Thank you so much, Hanan, and you don't have to apologize. So much, Hanan. I'm sure you don't have to apologize.
I can't hear you well. Please, can you repeat that?
No, I just said that thank you for the detailed presentation of your action plan. We already have 3 hands raised. So I'll be inviting Sora. You were the first to raise your hand. Are you able to unmute yourself? Do you have any questions, Johanna?
Thank you very much, Scholar, for giving me this opportunity to ask a question. One, I really appreciate the work of Hanan because it looks so comprehensive and well elaborate. Now, my concern is for uniformity purposes, because we are participating in this activity from different countries, and I expected the goal to be something which is attainable and something that you can achieve within a specified period. So for Hanan, goal is not really very clear to me. Number two, then the length of, are we writing a composition, or we are supposed to write just in terms of comments, or can we have something which is common to all of us so that we get a clear understanding of this action plan? Thank you so much.
Okay, thank you for your comments, Sora. The next person we are going to listen to is Ahmed Aldar. Ahmed Aldar, are you able to unmute yourself?
Yes, nice to meet you. Nice
Just a suggestion, Charlotte, from me. Sorry to interrupt. Anna Minta is in the room. I don't know if she's given feedback yet. I think it might be good to get some expert feedback as well as peer feedback, Charlotte. Just a suggestion from me. Over.
Yeah, thank you, Reda. I intended to listen to the peers and then turn towards Anna for her feedback. So,
okay, that makes sense. Yeah, thank you.
Okay, so Ahmed, over to you.
Thank you very much. Good morning. Only I share my action plan. It's not
okay,
more detailed like Hanan, but it's pointed in items. Yes.
Ahmed, do you want to share your action plan?
Yes. No.
Okay, so please be patient. Let's listen to, we're going to listen to feedback for Hanan's action plan, and then before we turn to you.
Yes.
Okay, so Eric Maita, over to you.
Hello, everyone. Hopefully you can hear me. So
yes.
Yeah, thank you very much, Hannah, for sharing that very elaborate content. Like the former officer who have just submitted, I think the content is good. But from what we learned since the first day, we are supposed to conceptualize those content and come up with the gaps or the challenges that that affect VPD surveillance, and then form or develop a challenge. Now, from that challenge, then we look at the issues that affect the workforce, the laboratory, the information system, and applied research. So the content is good, but I think we now need to look at what are the gaps in that content so that we work on that. That is my honest submission. Thank you.
Okay, thank you so much, Eric. I would like to turn now towards Anna Minta, our guide on the side. Anna, you've listened to the work that Hanan has already done, and to the feedback given by Sora and Eric in terms of the details. But there was also a question from the start by Hanan asking, are all of her actions, I don't know if I got you well, Hanan, you may come back to that, but she wanted to find out if she should only focus on short-term actions, medium-term actions, or long-term actions, or she could actually have in her action plan short-term, medium-term, and long-term actions. Over to you, Anna.
Okay, thank you so much, Hanan, for sharing your action plan so far. You have done very great work, very detailed in your background and giving the context for the reader and the listener so that we can understand the challenge that you present and the your plan for that. So that was very well done. And thank you to your colleagues who gave you initial feedback. So to start, I'll first address your question and then talk about a few other things. So in terms of the action plan, it is a good idea to be as detailed as you can. So in that regard, I think it would be good if you can list short, medium, and long-term plans that are all tied together to help you reach your goal. So I wouldn't limit yourself to only one of them. You've done a lot of work so far, and so you can go the step further and add in different lengths of time. And then to just make a few comments to address your colleagues and then also for everyone. I think it's a very good idea to be very detailed in your background. As Hanan was going through, I saw a number of opportunities for integration.
I'm hearing you, Maxwell.
So I saw a number of opportunities for integration, which is one of the key things we're trying to address with the comprehensive VPD surveillance strategy. And just an example is Hanan mentioned that right now there are training for the VPD staff, they're training for surveillance staff, they're training for lab staff, and they don't always go to each other's trainings. And so the initial challenge that she mentioned, that the lab samples are not getting to the lab on time, could go back to workforce. It's an issue with the lab, of course. It could also be an issue of funding. It sounds like because she mentioned in the plan that the national level would have to support some kind of meeting for everybody to come together. So this one issue raises a number of different topics for the objectives in the comprehensive VPD strategy. So as you see your issue, you can think through those and then focus on the one or several that would be important to you. And then in terms of the specific action that you've mentioned, and coming back to your colleague who was suggesting that maybe you could go into more detail there, I agree with that. I think it's a good first step to consider a meeting with everybody who's involved, that's all the stakeholders, to talk about what needs, to kind of go into some detail about what needs to be done. Maybe before you get there or in addition to that, I would like you to consider, and you've probably already considered, so maybe put it into your action plan. What exactly is the challenge that you want to fix with the lab specimen issue? Are you seeing that it's a challenge at the health facility with the samples being collected on time? Is it a challenge you mentioned there's different levels of lab for the specimens getting from the health facility to the first level lab, or from the first level lab to the lab that will do the advanced testing? Is it getting a hint from your plan that there's an issue maybe with supplies? So maybe there aren't enough lab kits or something, and so they're not being tested on time. So maybe you can go into some details about what you would like to address with those particular issues. And then also, if you are saying that it would be a good idea to have a meeting, then in your threat section, you can also address the particular issue we have with meetings, that sometimes we have a meeting, and people have some good ideas, but then nothing happens after that. Another challenge could even be if the country is not used to having these meetings with different stakeholders, how will you motivate them to see that this is an important issue and that they need to come to this meeting and then have actual inputs? So I've given a lot of different suggestions. Hopefully you've noted them. And again, I wanted to close by saying you did a very, very good job so far. You're in very good shape. And so I think with a few more considerations, you can take the action plan to the next step. Thank you.
Thank you very much, Anna. I really appreciate it. I will definitely consider all of your feedback and trying to shape the actions more clearly. Thank you.
Okay. Thank you. Okay, so I wanted to thank Anna and Hanan, thank you, Hanan, for sharing your action plan, and Anna for the very useful feedback that I'm sure is not only going to help Hanan, but also very useful for all those who are actually working on their action plans. We had Ahmed Alda. Ahmed, you said you wanted to present your own action plan, so
Yes.
we'll give you 5 minutes. 5 minutes to do so. You can share your screen, and then
yes,
we'll get feedback from peers.
Only I can't share, but I can only discuss my challenges and my aim only.
Okay, that's okay.
I can't share it by phone, but I can. I read.
You are on the phone. Okay, you will be listening attentively. Can you? Yeah, we'll be listening keenly. So, can you share your challenge and what you've already done as far as developing your action plan is concerned?
Yes, my VDBV surveillance challenge is shortage and sustainable finding for VDBV surveillance. This is my challenge.
Sorry for interrupting you, but please, can you start by introducing yourself so that we understand where you are, level of the health system?
My name is Dr. Ahmed Addar from Yemen, National AFB Surveillance Coordinator Assistant. AFB Surveillance in Yemen. My VDBV surveillance challenge is shortage and sustainable finding for VDBV surveillance. My goal, sustainable VDBV surveillance system, integrated and comprehensive with sufficiently finding in 2022. This is my goal. That's clear? You hear me?
Can you come again?
You hear me?
Yes, we hear you.
Hello. My goal, sustainable VDBV surveillance system, integrated and comprehensive with sufficient finding in 2022. Yes. Hello.
Yes, we can hear you.
Yes, this is my this is my challenges. That's clear. My challenge is shortage and of funding for VDBV surveillance. Workforce, lack of governorate finding in my country due to we have war in Yemen. Weak motivation of health worker in VPD surveillance. We're in conflict area, which need a high transportation cost and dangerous. Training capacity building, it's not good. Also, this in laboratory weakness of national lab network. We haven't lab for polio, only send our samples to Camry or Oman. Also, we haven't in governorate lab, only in central lab, which can examine measles. Also, this is the most important. Also, we have weakness of cold chain and transportation. Information system lack of technological capacity, weakness in human resource. Applied research, we haven't limited research center. Epidemiologists, the specialists dropped out to work with other organization from governorate. The large financial cost of copywriting also. Sustainable finding, lack of governorate finding, as discussed. Also, a very limited combination between the public and private sector. My goal, this is general goal, sustainable VPD surveillance system, integrated and comprehensive, with sufficiently funding in 2022. That's enough. Thank you.
Okay, thank you so much, Ahmed. Since we don't have so much time again, we have just about 10 minutes. If you have any thoughts about Ahmed's sharing, I hope you were able to hear his challenge, his shortage of funding for VPD surveillance in his country, Yemen. Okay, I see Hanan, your hand is raised, so I'm just going to turn quickly towards you before turning towards Anna Minter for her feedback. Okay, Hanan, over to you.
Thank you very much, and thank you, Ahmed, for the explanation. I would recommend like finding other sources of funding, like NGOs. How can they support Yemen in developing sustainable funding mechanisms, and maybe trying to have support, financial support from sources other than the government. Maybe this will help, solving the issues of vaccine-preventable disease surveillance other than the human resources. Thank you.
Thank you very much.
Okay, thank you, Hanan. Anna, and we see here it's a security, a compromised area. You know, what should, based on Ahmed's action plan in that particular context where the resource constraints are compounded by security problems, if he's thinking about integration of his the VPD surveillance, what should he keep in mind? Anna?
Okay, thank you so much, Ahmed, for your explanation. It looks like you've gotten off to a very good start, and you've thought through some of the challenges. It's good that your goal was, it's in line with the strategy because you focused on sustainable financing. And it's also good that you have a time limit of when you would like to achieve the goal by, which is also helpful to make it, to have a time limit so you know what you're working toward. I think that the security challenges definitely, adds another element to this, which may be challenging because you will also have to set the stage for your readers about what exactly the challenges are and how that would affect the ability to get sustainable financing. And also thank you to your colleague Hanan for suggesting some ways to improve the financing. And I wonder, in the settings where there's insecurity, there are often some NGOs that are still able to get in there. So maybe that would be something to pursue. And then also I wanted to just mention from the rubric for everybody, when you are thinking about your goals, there's a section in there that asks, how does success look like? And how does a specific goal contribute to the VPD surveillance goals, which you've covered? And how will you know that you've made progress towards your goal? So you can consider those two. What would it look like for there to be sustainable financing, especially in the insecure areas? How would you know that you've reached the goal of improving sustainable finance by 2022? So those are a few things to consider. Very well done. And I look forward to hearing more about when we get to the end. Thanks.
Thank you. Thank you, Ahmed. Thank you, Anna. And I saw a question in the chat. Say please, from Samuel Gia, kindly state the steps of peer review. So Samuel, tomorrow our real focus now is really on the submission of the action plan as from after midnight. That's after midnight on Thursday. Tomorrow it's only as from Friday morning, Friday 1 a.m. that peer review will be open for you in peer grade. So during tomorrow's peer support session, at the end, we are going to look at the steps how to conduct peer review. And then we'll look at that in more details during the peer support session on Friday. But just to have in mind that peer review is indispensable for you to move forward in the course, because your peers will not be able to complete the course without their help. They will need your feedback. They will need your constructive feedback, your comment to improve upon their VPD surveillance action plan. And you also will need their comments and their feedback to improve upon yours. We have already seen a bit of that during today's session from the presentation of Hanan and Ahmed's action plans, though incomplete. So tomorrow, I hope you'll be ready. You will get set to also come and share your own action plan. I just shared a link in the chat. It's a link to the Telegram channel for you to be able to check the SME answers. You know, we collected the questions that you shared in the chat during session 1, and we shared them with our subject matter experts, and they have provided answers to those questions. We put them together in a Word document that was shared this morning on Telegram. I've just shared the link in the chat, and let me just take you to a Telegram page so that you see exactly where it is. So I'm sure you can see my Telegram page. So this is the document. Let me just move up. So here is the document. Please find attached answers in Word comment from WHO and CDC subject matter experts to questions asked by course participants on Monday, 11 July. So during the first session of this course. So once you have reviewed these responses, please reply to this message to share with your colleagues what you learned. So here, this is it. And I just put in the link in the chat. You can click on that link. It will take you directly to Telegram and to this message. You should be able to easily, it's a document that is it's just about, it's very small in size. So you just click and download it, and you should be able to see responses to most of the questions. And please do not forget to leave a comment. Some of those questions will be useful to you as you develop your VPD surveillance improvement action plan. All right, so we have just about 3 minutes left before the end of this session. And I just wanted to remind us as well of the various deadlines, just to know that the most important deadline tomorrow, Thursday, for you to submit your action plan. Please make sure you make progress on that and submit it before the deadline tomorrow, 11:59 p.m. Geneva time. And you have up till Monday, 11:59 p.m. Geneva time to submit 3 peer reviews of your peers' action plan. And then after that, the last deadline will be communicated with you. But I really want you to pay attention to these two, because your completion of the course and your certification depends on that. We also shared the link for you to share your attendance. Remember that attendance of the mandatory sessions certification requirement, and for you, proof of your attendance is first and foremost the group report work, so you can check if your rapporteur submitted the rapporteur's note yesterday, but also you checking to ensure that you submitted your individual feedback for session 1 and 2, so that at the end of the day, you are not going to miss out on certification because you forget to do any one of these 2 steps. And now, the 2 key documents, I already shared the rubric in the chat. It will be amazing if you have not yet downloaded this document. So I'm so sure everyone in the room, since you all indicated you have started working on your on your VPD surveillance action plan, I am sure you have already downloaded these 2 key documents. That is the rubric and the template, the Word template, the action plan template that is in Word, that I'm also going to share right now in the chat. If you are here and you have not started working on your action plan, just download the document and start working on it right away. And remember, when you're working on the template, remember to change the highlighted part, that is the title, to summarize in a few words with an action verb what you propose to do. So what your action plan is all about, what you're going to be taking action on. So some people submit their action plans, they forget to change that title, which is highlighted in yellow. Please do not forget to do so. All right, so that is it. And we have another date tomorrow at the same time for for our next peer support session. And please prepare to share the progress you have made as far as developing your action plan is concerned. So tomorrow, it's very important for you to take part in this peer support session, because we are going to go into more details. Look at, you'll be presenting your action plan, and you also have the opportunity to receive feedback from our subject matter experts. So do not miss the session, even if you don't need support, but you can join. And during that time, you can get to listen to some feedback or to the peer presenting their work that will help you to enrich what you're already doing or enrich your own work. So do not miss out on our appointment tomorrow. So I'd like to thank you once again for the active participation. Thanks to all those who were able to share their action plans, Hanan and Ahmed. And thanks to Anna Minter and the other subject matter experts, and India and Jamil, that were here to be our guides on the side. Look forward to seeing you tomorrow. Until then, bye for now. And if you have any questions or any challenge, do not hesitate to use the Telegram channel, the dialogue channel on Telegram, to ask your questions. And other peers will be there in the scholar spirit of peer support to answer your questions or your concerns, or also to support you. So one thing I would like you to do for me now is, if you found this session useful, I would like you to go now to Telegram. Go now to Telegram, just use this link I'm sharing to the Telegram channel and say what you and share your thoughts, what how you found this session, if you found it useful, and why you'll be encouraging other peers to join. So look forward to seeing you tomorrow at the same time, 11 a.m. Geneva time. Until then, have a great day. Bye for now.
Bye-bye.
Bye, thank you.